A stroke is when the blood supply to part of the brain is blocked or reduced, which prevents brain tissue from getting oxygen and nutrients. So brain cells begin to die within minutes. This makes strokes a medical emergency that requires immediate treatment. Around the world, about 15 million people have a stroke each year. Out of these people, 5 million die and another 5 million are left to live with a permanent disability. Stroke survivors usually suffer from physical and emotional complications. Some examples of such complications include paralysis of one side of the body, difficulty speaking, memory loss, mental retardation, depression, and many more. These symptoms we just mentioned are just a scratch of the surface. Do you see how devastating living with the aftermath of a stroke is? It has been observed that women are more likely to experience severe strokes and have worse outcomes compared to men. This is why in this video, we will reveal to you 10 symptoms of strokes in women. We recommend you stay until the end of this video as recognizing any of these signs can one day save a life. Now, without any further ado, let's get to it. Number 1. Sudden numbness or weakness. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, can be a strong indicating sign for strokes in women. Like we explained at the beginning of this video, the danger of strokes lies in them obstructing or decreasing the blood flowing through brain vessels. Depending on the area in the brain affected, symptoms arise. If the stroke affects parts of the brain that control muscle movements, then symptoms manifest as numbness and weakness. When this area dies due to inadequate blood supply, the muscles no longer receive any signals. The affected area suddenly feels weak or numb. You might struggle to lift your arm or leg, or have one side of your face drop, making it hard to smile or speak clearly. Approximately 75% of stroke survivors experience weakness on one half of the body. Number 2. Headache. An intense headache with no obvious cause can be your brain's own way of screaming for help because it is not receiving enough blood. Sometimes headaches can also occur due to a hemorrhagic stroke. This happens when a blood vessel in the brain bursts, leading to bleeding and the accumulation of blood in or around the brain. The pressure from this accumulated blood can increase your intracranial pressure, which is the pressure inside your brain. This sequence of events manifests as headaches. Even though headaches accompany many other dangerous health conditions, strokes are characterized by causing a severe headache with a sudden onset. Around 25 to 30% of stroke survivors report this headache and describe it as the worst headache they have ever experienced. Number 3. Nausea and vomiting. Intense, unexpected nausea that can lead to vomiting can occur due to strokes. It's often accompanied by dizziness where you feel that you or your whole surroundings are rotating around. When blood supply to your brainstem is cut, areas that control nausea and vomiting die. This causes these body functions to be out of control and manifests suddenly without a prior predisposing factor. Number 4. Pain in the body. Now you may be wondering, how can a stroke cause pain in your body if it only directly affects the brain? Well, sometimes the dying areas in your brain can send signals of pain to various areas around the body. This is a less commonly reported symptom, only affecting 10% of those who suffered from strokes. The uniqueness of this pain can help you identify it and relate it to a stroke. It's described as a sudden, sharp pain, most commonly in the face, arm, or leg. It can't be confused with typical muscle soreness or injury. Number 5. Vision problems. In strokes, vision problems can affect one or both eyes. This is when the occipital lobe of the brain doesn't receive enough blood and nutrients. This is the part of the brain that processes and translates the light signals received by the eye. Moreover, problems in the eye can also manifest if stroke affects any part of the pathway of nerves that connects the eye to the brain. After the occurrence of the stroke, patients report blurry images, double vision where they see two of everything, or they might lose vision in one or both eyes completely. In addition to that, patients may be able to see less area of the visual field in one or both eyes. The visual field is the area seen when your eyes are looking straight ahead. including your peripheral vision. These visual symptoms are present in 30% of stroke cases. Number 6. Confusion and difficulty speaking. Confusion accompanied by trouble speaking or difficulty understanding speech can be a sign of stroke. This occurs when the stroke affects the blood vessels supplying either Broca's area or Wernicke's area. Broca's area is a region is your brain responsible for producing speech, whereas Wernicke's area is the area responsible for understanding language. Around 20 to 40% of stroke survivors suffer from this symptom. They feel that they might know what they want to say but can't find the words, speak in jumbled sentences, or have trouble understanding others. Brain strokes also affect the cognitive function and memory of the person, which leads to confusion and anxiety. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 7. Difficulty walking normally. If you have sudden trouble walking, dizziness, loss of balance, or coordination, then it may be your body warning you that you're having a stroke. Your body movements are affected when the stroke affects the cerebellum or the inner ear structures. The cerebellum is the area in your brain responsible for voluntary movements, while your inner ear structures, known as the labyrinthine, help maintain your balance. If you're having a stroke that affects any of these areas, you may feel unsteady, as if you're about to fall. Additionally, inner ear disturbances can make you feel as if your surroundings are spinning. These symptoms are reported by 40% of stroke survivors. Number 8. Fainting. Fainting due to strokes can range from mild lightheadedness to complete blackout. The explanation for this is that a significant decrease in the amount of blood flowing to the brain can cause a sudden drop in blood pressure, leading to fainting or unconsciousness. While anyone can faint for a variety of other less serious reasons, paying close attention to the body can help you recognize other symptoms and get adequate medical attention immediately. According to analytic data, fainting occurs in about 10 to 15% of stroke cases. Number 9. Seizures. Seizures are random, sudden, and involuntary bursts of electrical impulses in your brain. The result of seizures is temporary muscle contractions and fluctuations, sometimes even muscle rigidity. Brain strokes can cause seizures because they damage brain tissue, resulting in abnormal electrical activity between your brain cells. If someone suddenly exhibits uncontrollable shaking, jerking movements, or muscle stiffness, sometimes along with a loss of consciousness, they must be transported to the nearest hospital immediately. 5 to 10% of stroke cases exhibited sudden seizures along with the other symptoms. Number 10. Hiccups with chest pain. Even though hiccups are incredibly irritating, most of us think of them as just an inconvenience, nothing serious. Despite hiccups being a less common symptom, they still can help you identify a stroke. With strokes, hiccups are accompanied by widespread chest pain. Hiccups that accompany strokes are continuous and don't go away with typical remedies and maneuvers. Hiccups along with chest pain are reported only by 2 to 3% of stroke patients, making them the least common sign in this video. So, these were the top 10 symptoms of strokes in women. As you may have noticed, each symptom coordinates with the area of the brain affected. This is why not all these symptoms may accompany a stroke. Recognizing these symptoms and providing immediate medical care to the stroke patient is critical for a better outcome. Now, we want to hear from you. Did you or anyone you know ever experienced any of these signs? Did they manifest because of a stroke? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.